So initially we'd go through some questions, some very personal questions about your sexual health. For example, when you last had sex, who you last had sex with, type of sex that you had. Then we'd go through some information regarding symptoms that you may have, such as discharge, frequency going to the toilet, any burning pain, anything that's changed over the last couple of weeks that you feel is not right for you. Depending on whether someone has symptoms or not will vary as to which tests we do. We test for chlamydia and gonorrhea on everybody. If somebody's got symptoms, we might do a variety of other tests as well. For a male patient that's come in just for routine screening, we take a urethral swab. Now, it always sounds scary, and a lot of the guys come in saying, oh, you're not going to use that umbrella. I'm not quite sure where that's come from. However, the swabs we use these days are just these little swabs. It's just a matter of putting this little area into the urethra, giving it a little twist round, which is slightly uncomfortable, literally takes a few seconds. It's placed in the pot and it's sent off to the lab. And that's the test for chlamydia and gonorrhea, which is the most effective test. However, if somebody really is scared of having that done and doesn't want to have it, they can just wee into a cup and we can take the test from the urine only. It's not as sensitive, so it's not quite as accurate as doing a swab, but we can do that. So female routine screening, they'd come in for chlamydia and gonorrhea. We'd insert one of these plastic speculums inside the vagina, okay, and just open it up slightly. It's not painful, it's just all a bit uncomfortable, a bit embarrassing, a bit unpleasant, but it doesn't hurt. Okay, and then we literally take some swabs, similar to the male swabs that were taken, and they're just put inside the speculum, scraped round from the cervix itself, and then sent away for testing. Again, if a female really doesn't want examining, doesn't want someone else to be doing that test for her, there is another test they can do, and they can literally do it themselves. They can just go in the toilet, push up the swab into the vagina, give it a swoosh round, and then we can send that off for them. Okay, we check everyone routinely within clinic for with a blood test for HIV and syphilis. Everybody's routinely checked, as I say, unless you say that you don't want that test done. It's literally just a needle into the arm here, which is a little bit painful for a few seconds, and then we take one tube of blood, about 1 ml of your blood, and send it off, and the results come back at the same time as all your other tests that we did. The results, everybody sent a text message, whether they've got negative results or positive results. They will receive a text message within 2 weeks of being in the clinic. The text message, if they haven't got anything wrong, will say all of your results are clear, and if they have got something that needs treatment, it'll say can you contact the clinic, and there'll be a phone number to contact. Anybody that's having sex, obviously they need to get checked out regularly, make sure they're not catching any infections. Just make it part of your routine thing to do. I mean, don't be embarrassed, it's just something, you're just having sex and it needs to be checked out, but you haven't got any infections.